I'm Mayor Dwayne Warren. We are on Central Avenue in the city of Orange Township, right in front of Orange Park, and we have transformed this portion of the sidewalk into Recovery Central. You see up there, Reach is here, the county is here. I'm going to bring in some of our experts to let you know exactly what's happening on this spot in the city of Orange Township. We're at Orange Park, Central Avenue, city of Orange Township. We've understood the need for recovery, for prevention, especially in the midst of coronavirus, but we also know the fear about getting treatment, the stigma attached to it, and the mistrust that's in our community. Therefore, people came together and were innovative and said, we will bring the resources to the community. Young lady, what's your name?
Eileen Fishman.
Ms. Fishman, who are you with?
I'm the Director of Community Health Services for Essex County.
Now, you had an innovative idea that periodically you would come here to Orange and other communities because you thought it was important to have boots on the ground where the people are, bring the services where they are, bring the information where they are. Why is that so important?
It's really important to meet this population where they're at and for them to gain some level of trust that we're going to help them and do the right thing for them. People are very skeptical, and particularly those who are homeless or those who have other needs. And we like to encourage them. We like to educate them on substance use and misuse. We like to teach them preventive acts. And also we would help them come into recovery. Sometimes they come multiple times. Once they know that we're going to be here, they come regularly. We have many ancillary services we combine at the same time. We offer them information about county programs that are going on, as well as programs within Orange, which is this town, but in all the towns that we're in.
Just list briefly, if you could, the partners that you have in this event and the kinds of information and services they can expect.
Well, today we have Integrity House with us, which is our partner that really represents education and prevention, as well as recovery for those people in need who choose to participate. We also have Iris House today with us, one of our partners, and they will do HIV screening, assessment, and testing. We have Women's Health through Integrity, where any woman can come to talk to our staff member to find out programs that we can help them with for women's health. I'm trying to think, let's see. We have a nurse here who will do assessments and who will teach people how to give Narcan in case they know a family member or a person who may be in distress, and they will be able to help save their lives to revive them if they overdose.
Very nice. And you haven't left out the nutrition side of the equation either with your partnership with the food bank.
That's correct. We have a wonderful partnership with New Jersey Community Food Bank, which we're very excited about. And of course, nutritional needs are very important, and they can get that information. People coming here can get that information and be helped in that regard also.
Very good. There you have it, care in our community. If you have a need, if you struggle with addiction, if you need services, if you are a woman in our community, please reach out. You'll see the number there on the screen with the flyer. You'll also see the schedule where they're here in the city of Orange Township. Thank you for all that you do. Thank you at the county for bringing the resource to our community.
Thank you so much. We appreciate being here.
Central Avenue, city of Orange Township, in front of Orange Park. No, we're not in a clinic. The clinic came to us. There's a need in our community for outreach, for addiction, substance abuse, and just for resources in our community. Thanks to the county and a brew of partners, they brought the resources to us. You see Reach here, but Reach means more than just reaching out. Reach means delivering services in our community. And first I have with us who?
Rebecca.
From where?
I'm with the Women's Wellness Center at Integrity House.
Now, the Women's Wellness Center is in an Integrity House, which is downtown Newark, but you're here in Orange on the scene. Why is it so important to take your services on the road?
So basically, my job as an outreach specialist is to locate women who don't necessarily have a drug or alcohol addiction, but we do offer support for those services. And just help them, like if they're struggling in any areas of their life, whether it be with mental health, needing to locate housing, financial management support, employment services, you name it, we're there. And we have fun activities for the women that we do on weekends. So we just had a pop-up shop this last weekend, just to kind of like give them some ideas for things they can do to make some money and stuff like that. So it's a great program. It's relatively new. So we're just trying to get the word out about it throughout the county.
You're in an urban community. You know that COVID just hit it hard, and you're in a community like so many others where women are heads of household. How critical is your service at this time?
Oh, I would say it's extremely critical. Like right now, I'd say most of us are struggling with mental health, and especially those who are most in need who, don't necessarily have the income to support their families at the moment, dealing with COVID and everything that comes along with that, job loss. So I would say it's a huge need right now.
There you have it, women in the community. There are people out here that can help. Reach is a service that's vital to our community. We all know the strong position that women hold in households, on jobs, and in our community generally. So I encourage you to reach out. You see the flyer on the screen there. Please reach out. Rebecca, thank you for all that you do in our community. Speaking of women in our community, Councilwoman Adrienne Wooten, you've been a standard bearer for strong women and making sure that we have our rightful place, whether it be in government, in corporate America, in non-governmental organizations, and in our community. How important is it to you to have Reach out here, reaching out for resources for our women?
It's very important for agencies to come to our town like this, especially to visit hotspots in the city of Orange Township. It's pleasing to see them here at the park where there's definitely a need, so I want to thank you for that, as well as being on Main Street.
So you've indicated that it was smart to come to the hotspots. Why is that so important?
When you come to the hotspots, that's where you actually meet the people on the ground level. They are not hiding here, they're just going about their daily activities. As you can see, certain people walking down the streets. We see people on the park benches who may or may not have a problem. So it's very important for you to come to where they are.
And just tell me, wrapping up, when you walk up on the street and you see this van out here for testing, you see all these t-shirts and you see the big word Reach, how does it make you feel, given that you've had an entire agenda about public health, about fighting corona all throughout this phase of the COVID-19 crisis?
It's pleasing to be in a city where our mayor not thinking robbery, in a county where the county exec not thinking robbery to take care of our people in the city of Orange and in the county of Essex, which is something that you and Joe DiVincenzo have done since March of last year with COVID.
Thank you. There you have it. The team is in place. Let me bring to you people who came all the way. They booked the flight and came from Toms River, New Jersey. Give them a shout. Sir, who are you?
My name is Gary Sheridan with Integrity House in Toms River, Ocean County, and also the Ocean County STAR program, support team for addiction recovery.
Now, there's a lot of distance between Orange and Toms River. Why do you find it so important to be here observing what's happening today?
Because your boots need to be on the ground day in and day out. It doesn't matter what county you're in, what town you're in. New Jersey suffers big with opioid addiction and alcoholism and many other forms of addiction, as well as a lot of mental health. And the importance of us coming up here was because we're with Integrity House, which is an amazing team, and we wanted to be a part of it today. And we will continue being a part of it, and actually are now looking and considering doing something very, very similar in Ocean County.
Excellent. Tell me about the team, because you don't travel alone. They say when you leave Toms River, you travel with a team. Yes. So just quickly, if you could, may I just introduce your team? Okay. I'm going to go with the Toms River team. Let's hear it.
Hi, I'm Stacy Forte.
I'm Mel Ferrara.
Richard Sisler.
Ashley Rochelle.
Jesse Kaufman. Michelle Runinghouse.
We got the Toms River crew. That's the Toms River crew. Now, this is what the Toms River crew does when I say Toms River. Toms River!
Toms River!
There we have. Thank you for our partners all the way in South Jersey for coming up and deeming it not robbery to be a part of our effort. We have some other experts in the field. You've been in the field of human services for some time. What is your position?
My name is Shawnette Luke, and I'm the nurse on the team for Reach for Recovery. So what we hear when we're in the community, we're giving information. My role in this team is to teach anyone that comes up to our table that tells me that they are actively using or they need any type of help. We give out Narcan. I do a lot of education with the people in our community.
Explain to us what Narcan is.
Narcan is a life-saving drug that you can use to reverse the effects of opioid use.
If I'm an opioid use and I'm at the point where I'm on the ground almost dying, what happens?
And someone has Narcan, they will give you the spray in your nostril, and then they will turn you on your side, because sometimes when you are, overdosed with drugs and you get the Narcan and you come through, you might vomit. So we don't want you to aspirate in your lungs and kill yourself. So with that, it gives you that window that you can call for help. You can call medical help. So it's very important when you use Narcan, you still must call 911 because you still need the help.
With that important phase, and you're bringing them back, and you're reviving a parent, you're reviving a brother or sister or important family member, how does it make you feel that you have this other team around you that can wrap around for other services that may be provided?
It feels great because when you come out to the table, sometimes, most of the time people have a multiple of things that are happening. There's having homelessness, mental illness. A lot of people, what I've seen, when I do their vitals in our community, has a lot of hypertension, diabetes. So these are the things that we can send them to SNAP so they can get nutrition, education, and a lot of food insecurity. So all of the services combined is going to provide a great service for everyone in our community.
Excellent. Thank you for all that you do. Our nurse mentioned that there is a nutrition component here, and I have who with us?
Keith Jackson from the Community Food Bank of New Jersey.
What is the Community Food Bank of New Jersey?
It's an organization, nonprofit organization that serves 15 of the 21 counties. I'm from the Resource Access team, and what my team does is we go around in the community and we assist people with applying for SNAP benefits.
And SNAP means?
Food stamps. They used to call it food stamps, Supplemental Nutrition Assistance Program.
And that's where families can go. They get food. You guys can provide the food. Is there an intake process? Is there some kind of process where you have to qualify for SNAP?
Yes, based on income, of household size and income, and then citizenship status.
So your resource access line that we have on the screen, is that the best way to contact the food bank?
You can contact us there, and one of my team members will be able to assist you with applying for SNAP benefits.
And then I have to also brag that your organization has been a community partner with Orange for a long time. Throughout the pandemic, you've been there at each and every turn. We want to thank you on behalf of the entire city of Orange Township. Thank you for being here today.
No problem. Thank you for having us.
Thank you. Every organization, every event like this, every initiative like this always has a boss. And I bring to you now the boss of this initiative. What's your name?
My name is Alana Moses.
Ms. Moses, now how do you get to be ahead of all of this and directing all of this?
Honestly, it was a gift that was provided to me through Integrity House, and they asked, would I be interested? I said, oh yes, I'm about the community. So we partnered with Eileen, and from the county, she's the director over this, and we began to communicate, and I asked her what was her mission and her purpose and what did she want to do, and she told me just outreach to the community and make sure that we reach the hard to reach people. And I said, okay, that's what we're going to do, so that's what we're doing now.
Sometimes when you come into communities where you haven't built up the trust, where people are having difficult times, they don't want to trust you. They don't want you into their lives. They don't want you into their business. How do you break down those barriers and to give people help?
Well, the first thing you have to do is, come out into the community with an open mind. So you have to come out and knowing that you're going to reach a community that may be resistant. And in order for you to break those barriers, you have to be first kind and you have to be approachable. Introduce myself, tell them what we're here for. The purpose, we're not here to force you to do anything, we're just here to provide help. And just build a relationship with that person. Sometimes it takes a few seconds, other times it takes minutes, and it may take an hour, but we have the time to do it. And so with that being said, we just offer them, opportunities for help. And it might not be for them, it may be for one of their relatives. So we don't put a stigmatization on it's you. We say, if you know someone or you yourself may need help, we have the help. We can have help come to you, or you could come to us. So however the help is here, we're going to be here. When it's your timing. We have peer recovery specialists that will call and will ask, are you ready? Would you like other resources in the community? And so we continuously follow up with our clients. We have substance use disorder screenings for those who are ready at this point and they're ready to get into treatment. All we do is do screenings, medical screenings, which is done by the nurse or a counselor. And when they finish with the screenings and they say, are you ready now? No, not ready now. Okay, no worries. We have your paperwork. We'll call you. Ready now?
So you do
yes,
the follow-up.
We do the follow-up. Follow-up is one of the most important resources that you could do with the person because they know someone cares.
Now, there's some people out who are struggling from diseases before there was a coronavirus. There was HIV. I know you run into many of them. Briefly tell us about the partnership that you have to address that issue as well.
So we have a great partnership with the Iris House. And we also have another partnership. They're not with us today with Hyacinth Foundation. Iris House is here. They come out into the community. They do outreach. They talk about, how to get people into treatment. And if you don't know your status, there's a counselor here that provides testing and counseling, very intensive counseling. They talk about, your risk of behaviors that may lead you to possibly being HIV. And if you are HIV, we send you right to medical treatment. If you're negative, we give you preventative education plus condoms so that we help you stay negative. And then, we always make sure that the community understands through education why it's so important to know your status.
Well, I want you to have them come over to me because I want to talk to them as well.
Okay.
The information on your screen, is that the best way to contact you? That phone number, that email?
Yes, the information that's on the screen. Please contact us. Somebody will pick up the phone.
And when are you here? When are you in Orange? Do you have a schedule?
Yes, we actually have a schedule. So in Orange, at this site, we're here every fourth Monday of the month. And then on Main Street, we are actually there every second Wednesday of the month.
Okay, so
And-
fourth Monday, second Wednesday,
Yes.
you'll be here in Orange, either on Central Avenue or on Main Street.
Main Street, yes.
So we'll put the schedule up on the screen. What times
The times is from 10 o'clock a.m. to 3 p.m.
on both days?
On both days, yes.
Very good.
Yes.
Now, I'm giving you the boss of this operation. I call her the boss because when the mayor of the town came up on the phone, she said, put your phone away, come over here and learn about the resources and the outreach we're doing in this community. I'm certainly glad I did. Thank you very much for all that you do.
Thank you. Thank you for coming out and just seeing what we do here and just know that we're in your community
Yes.
to make it our community,
Yes.
to help the community and better service the people in Essex County.
Thank you very much.
Thank you.
You've heard Integrity House, but I'm going to get the last partner, the Iris House. It's a critical operation. You've seen the van. They're ready to go with all types of testing. I do want to bring them up so they can tell you about their educational and preventive outreach. I'm here with the Iris House crew. We're on Central Avenue at Orange Park, City of Orange Township. Iris House, this is all about outreach to the community on various resources that we have. How does Iris House fit in?
So thanks to Alana and her partnership, she reached out to us here at Iris House in Plainfield and asked us if we would come out and do free HIV testing for those people who come into their services for substance abuse. So we basically pass out free condoms and give free HIV testing to those who are interested. It's a 20-minute test. If somebody does decide to get tested, they can get a $10 gift card for getting tested. So that's basically the service that we provide. And then once they're on a van, if they're in need of any other services, housing, food, whatever resources they're in need of, we make sure that we make that referral so that they can get the sources that they need.
So this testing van you have, it's full service. You can do your interviews there, you can do your testing there. Now, if you get tested and you found that you're positive, what actions do you take at that point?
We immediately link that person into care. So if someone does test positive, our first thing to do is check on them, make sure that they're okay. And from that point on, we'll find out what it is that we need to do to get them into the right care right away. That's our goal, is to get people into care if they're HIV positive.
And if I'm at risk, are you teaching the kinds of behaviors that can put someone at risk and how to prevent it?
Yes, so what we do is like a miniature HIV one-on-one with them, and we basically tell them, how can someone contract HIV, what fluids or what behaviors puts that person at risk, and along with HIV, substance abuse comes hand in hand. So that's how we follow in with Alana and Integrity House.
Now, I know COVID has captured everyone's attention and has devastated our community in many ways. Does that mean we're out of the woods with HIV?
No, and that's another important thing that is good to point out. HIV is still a pandemic that we still need to put in focus, and it's very important that we get education out there and that we do get people tested, because the more people that get tested, the more people that are aware of their status, and that way we can get people insecure if they're positive and keep those who are negative by informing them on how to stay negative by using condoms and safer sex behaviors.
And just want to let you get a pitch in about the need to continually fund HIV prevention resources, cures, and so forth.
Yes, please. We definitely need funding for nonprofits like Iris House, CBOs. Unfortunately, funding has been limited, and we could use all the funding that we can get. For instance, our van is for 2 testers, but because of funding, we don't have the AC to bring in the 2 testers and have 2 people in a van at the same time. But if we did have more funding, we'll be able to purchase the AC so that we can test more people and then get more people aware of their status. So yes, fund us, please.
Thank you very much. And the information on the screen is how they can contact you. I know you have some partners here. You want to introduce who they are?
Yes, so Chris is our outreach worker.
Hello, I'm Chris.
Hello, Chris. You're here. You're working in this environment. Tell me how it feels to go on the road.
Oh, it's awesome to come out in the community and serve the people and see that connection, that one-to-one. It's really nice.
Thank you. And who else do we have?
This is Brenda, our prep counselor.
Now, Brenda is the shy one of the bunch. Brenda, what do you do in this operation?
Well, I'm the prep counselor. I provide prep education, and if the client is interested, I link them with a prep provider.
There you have it, full service. Iris is here. If you have the disease, if you feel that you might contract it or that you're at risk, come on down and see Iris House. It's private. You go inside. The van is fully outfitted, and they're ready to serve you. Global outreach here in the city of Orange Township. I want to thank all of our partners. We're right here on Central Avenue, right in front of Orange Park, city of Orange Township. I'm Mayor Warren.